This is American Surgery Center Bariatric Program. My name is Kemal Erkan. I'm the chairman of the program with Dr. Isaias Irgau, who is with me right now. Today is January 27th, and we are going to do our live session, weekly live session, and just making sure that I have everything confirmed from here. And I think we are good. So good afternoon again. So this is our weekly event, so everyone kind of knows who we are. Just to kind of give you the backgrounds, just so that you, in case you didn't watch our other videos, you know what our program is. We are American Surgery Center. Our bariatric program is unique in a sense that we are the only surgery center with the Bariatric Center of Excellence in Delaware. And the certification and the Center of Excellence from ASMBS, it actually is also kind of makes us pretty unique. We are one of the 15 out of 9,300 surgery centers, only 15 who has the Bariatric Center of Excellence, and we are one of those. My surgeons are the most experienced surgeons, not only in Delaware, but most likely in the United States in bariatric. I can say that easily. Now we have Dr. Irgau, so I'm going to ask him to introduce himself, and maybe he can tell us how many total cases he has done so far, so you'll understand what I mean.
Thank you, Kemal. Again, I am Dr. Irgau. I am the president of CHRIAS, Christiana Institute of Advanced Surgery. My specialty is bariatric surgery or weight loss surgery. I have been performing weight loss surgery now for almost 20 years, alongside with my associates, Dr. Wynn, Dr. Peters, Dr. Singh, and Dr. Ibrahim. We have performed close to 10,000 weight loss surgeries successfully over the years. We have a number of firsts when it comes to weight loss surgery. Certainly, we are the very first program that has established a very solid multidisciplinary modern bariatric surgery program in our state. Together with my associates, we were the first ones to perform the laparoscopic gastric bypass, the first laparoscopic sleeve gastrectomy, the first lap band in the state of Delaware. When it comes to experience in bariatric surgery, our practice is by far the most experienced in our area.
Thank you, Dr. Erkan. So I'm going to just share a couple of the PowerPoint slides that we have. And today we are going to discuss the reasons that patients are dropping out of the programs. And then we do want to keep everyone up to date with what we have in the surgery center and in our program, and why it makes it a lot easier for our patients to go through the process. Now, you already know these two people, so I don't have to spend too much time, but we do have our other surgeons, Dr. Gail Wynn, Dr. Michael Peters, Dr. George Ibrahim, so there's a little typo here. This is Dr. Rahul Singh, Tanner, we should update that. And Dr. Sachin Vaid, he's our colorectal surgeon, and our surgical PA, Sydney, who's been with us for a long time. And we have our nutritionist, dietitians team, Fran, Amy, and Beth, and this is one of the accredited organizations under the American Surgery Center with the partnership of United Medical ACO. So our dietitians are they are also specialized in bariatric, since they do deal with mostly with the bariatric patients and also patients with diabetes. Now, it's extremely easy when you have 100% patient satisfaction. It makes it a lot more enjoyable for us to come out and talk about our program, and we do appreciate our nurses, our medical staff, our surgeons, but most importantly, our patients who do actually fill out the surveys and share those with us. And they're extremely, in some cases, overwhelming. And we take that very seriously, and we thank you for being part of our program. Again, the patients, in many cases, we are able to go through the process and start to the end. In 2019, I did write an article regarding the bariatric programs and difficulties for patients to get bariatric surgery. And we had a couple options. In these options, one was we were just either going to be part of those problems, or we were going to actually find our own path and then just make it easier for our patients. And that was one of the reasons that Dr. Erkan and I, we looked into the surgery center option to see if we can have a 100% autonomous program to do what we need to do that we were not able to do in the other programs before. Now, we have care coordinators, some of whom are nurses, some of whom have been with us for a long time. They know the program very well. One of the biggest issues that we see is when there is no care coordinator assigned to the patient from start to the end, it's making it a lot more difficult. Now, Dr. Irgau, you have seen this from both hospital side and from the surgery center side. Can you tell us where this difference is coming from? And I have some follow-up questions.
Yes, absolutely. So essentially, weight loss surgery or bariatric surgery is different from other surgeries that we undertake because there is a preparation period that is really very important in order to educate and evaluate the prospective patients thoroughly before bariatric surgery. So patients have to see nutritionists with a number of sessions. They have to see a psychologist. Very often they will be seeing medical specialists, including a heart doctor, a lung doctor, and those visits may be associated with tests that have to be undertaken with those specialists as well. That takes time and that takes a lot of coordination. And as you mentioned in other sessions, Kemal, the American Surgery Center is unique because the care coordination work happens every day. The team actually meets every day to look at the steps the patients that are undertaking and to help them coordinate that. If patients don't receive proper guidance to navigate this system, it's very difficult for them to advance, and sometimes they can lose motivation and be lost in the process as well. So having that really makes the surgery center unique because the patients have all the support they need with a single coordinator assigned to them that will help them navigate the system. Really, that is very unique about the American Surgery Center.
So now one of the, I guess, one of the reasons this is maybe easier for us, Dr. Erkan, because of our technology that we use. And when I say technology, I'm actually referring to our database. And the database is something that you and I, we actually customize together from the beginning. Prior to that, I saw a lot of like Excel files and not understanding what was happening throughout the process. So I remember it was, I believe, 2012 when we first started using it. And this allows us to actually get a good, reliable data. And I do want to share that with everyone. And let's see, actually, from here, I see, and I didn't address this in my article, Dr. Erkan. When I say my article, I'm sure people know this by now. Everything that I learned in bariatric, I learned from Dr. Irgau, but I had a little bit more time to write. But one of the problems that we see is lack of bariatric benefits. Now, the first column you see here, that's 39, and this is in the last 2.5 years. So some part of 2018 and 19 and 20 altogether. So lack of compliance and these two reasons, we kind of use them gently because we don't want to blame our patients. And then not a bariatric candidate in some cases, either the BMI or some other health reason that they may have. And again, just to be gentle and polite to our patients, we use patient-related. In some cases, they may have some personal crisis that they may not be able to go through the process. But as you can see, there are 476 individuals just from the Surgery Center program. Now, what I want to point out, and I'm not going to actually make this too overwhelming, but very simply, this 476 total patients generated a total of 6,457 activities. Now, as you can see, this number is a lot bigger. So that's about, for each patient, almost averaging 15 activities we have to do. Now, just going through the main problems: lack of bariatric benefits, lack of compliance, not a bariatric candidate, patient-related, and we also have this group other, where we may need to actually go in and then make this a little bit more. Now, one of the other sad part of this, some of these patients, as you can see, they have completed the bariatric process before, and they couldn't actually go through the surgery. So there's always this, almost like Dr. Guy called this, almost like this hesitation, like they are doing everything until the end of it, and then they don't want to get the surgery just because they don't know if they're going to go through that. Now, what I see in here, if we have to do 15 averages for each patient throughout their process, and if they have to try 1.5 times, not one try, but 1.5 average, that actually tells us the problem overall, why this is happening. Now, other than the reason this is happening, we want to kind of know from your side what patients can do to go back. We have a new year started. What can we do to bring them back? Because we are still emailing these patients. Is there any different ways that we can help them to get back to the program?
Absolutely, absolutely. So essentially, bariatric surgery is a very serious form of treatment for a very serious disease, right? We are talking about the treatment of morbid obesity, obesity where the weight has gone really to extreme levels. We talk about body mass index greater than 40. We talk about a person having a weight which is at least 100 pounds over their ideal body weight. So if their healthy weight was 150 pounds, the person will be at 250 pounds, right? That is when bariatric surgery becomes indicated, becomes a treatment that can be recommended for somebody who's struggling with weight. So, but it is a serious treatment, right? When people hear about surgery, that is actually something that takes them aback, right? In fact, on average, most of my patients will tell me that when they hear about bariatric surgery as applied to them the very first time, they reject it outright. They think this is not for me. I can do it by myself. In fact, very often they may have even a sense of guilt, thinking that by going to bariatric surgery, almost like it's a cop-out, right? That they are getting out of the real hard work of losing weight. Well, what they don't realize at that time is that the reason they're not able to lose weight by themselves is because they are fighting their own biology. Once their levels of weight reaches those of morbid obesity, it becomes exceedingly difficult for anybody to lose. But the fact that they haven't lost is understood by them as failure. So they go on and on trying. And they feel if they have to do surgery, it's almost like they are choosing the easy way out. This is obviously perpetuated by the stigma that is associated with obesity by our society. Obesity really is a disease. People reach that level of obesity because there is a biology that drives that. That is the key, really. But without understanding that, patients feel guilty about looking out for surgery. So when they first hear about bariatric surgery, as I said, they reject the idea. But then over time, the idea matures in their head that maybe bariatric surgery is the solution for them. And then now, as you know, we are in a situation where the whole medical establishment has accepted bariatric surgery as a very important form of treatment for morbid obesity. So primary care doctors, family doctors are now routinely recommending bariatric surgery. There was a time in which primary care doctors would never even mention weight as a problem of patients when they encounter them, right? Many years ago, right? But now they recognize it's a disease, they discuss it with their patients, and when it's appropriate, they recommend bariatric surgery. So patients come to us with this type of perception and understanding, Kemal, and it is not unusual for them to still feel maybe I can do it by myself. Maybe this is not something that's necessary for me. And we see patients actually dropping out because of that. But what happens? What happens is the same thing that has happened for years happens again. They still are not able to lose weight. Just today, actually, I saw a patient that I had seen about 4 or 5 years ago, right? Their weight was around 270 pounds at that time, right? They started the process, they went through all the preparation, but then they decided they wanted to try to see if they could lose by themselves, right? And they were not. And they were 270 pounds then. When they came back to see me this time, the weight was up at 325 pounds, right? Much more increase, right? Which
So
means that their quality of life and also their risk of illnesses had gone way up by the time they have returned.
So, Dr. Gao, almost without an exception, when I do the daily case conferences, and I do actually just stop and then just point that out for our nurses and our other care coordinators. When the patient tries again, I always go back to the original trial of the BMI, and 99%, those patients have gained so much weight during that time. And one of the reasons that we are trying to make this a lot more efficient and smooth from the patient standpoint is because we know this is hard. We have, like there's a lot of different factors in this, but we made it a lot more easier than any other. I remember in the hospital programs at Irgau, because I was a big advocate of doing more case conferences, and at that time the idea was not supported by the hospital admin, and we couldn't actually really keep in touch with the patients. They would have one case conference, they would be discussed, and then they will be gone. So each patient today is being discussed on a daily basis every week. And that makes it a lot easier. Especially one of the other things that I want to point out is with the telemedicine, one of the biggest difficulties, and again, I do want to maybe just bring this up first so then we can just build on this. Access to care challenges, right? So this is from my article again. So the insurance companies are discriminating the patients. I say discriminating just a little bit, maybe loosely, just because there's a lack of term, maybe lack of better term, but it is a real discrimination. Now, you can read this later on. It's on our web pages. But what I want to really tell you is, if you're a Medicaid patient, and there are two big programs for Medicaid, and it's a state requirement. It's not like the programs, for example, Highmark has a commercial insurance, and Highmark also is a health option, which is one of the big part of Medicaid. So for nutrition requirement, if I'm a commercial patient, then I don't have to do X many nutrition visits. However, if I'm a Medicaid, therefore I have health options, then I have to do 6 consecutive months. And I find it really, one, is really annoying. 2, there are no days. 3, it just makes it impossible. So if the patient misses month 4, and if we are not able to get that patient in with the nutrition in the same month, there's a challenge of maybe that patient will start the program all over again. That's just ridiculous. Now, we have all these fights on behalf of our patients, but at the same time, we don't want to really focus on what we cannot change easily, but what we could change, which we did. We assigned care managers, care coordinators, and we used to, you remember those days, we used to have 2 people and for more patients, right? So right now, this morning, I had 9 people on the call just from care managers and care coordinators standpoint.
Absolutely.
That doesn't include an eye. So
yeah, absolutely. So it's interesting, Kemal, because when I was talking earlier on, I was talking about how difficult it is for patients to overcome this stigma about choosing bariatric surgery and how long it takes them to really accept the idea that bariatric surgery is a very important treatment for them, right? But it's also interesting to see that when patients make that decision, when the idea matures in their head and they finally accept and understand that bariatric surgery is extremely beneficial for them, then they want the surgery to be done immediately, right? And then they come to the office, we have a consultation, and very often we will say, well, your insurance company actually requires you to do so many nutrition classes. And in some insurances, as you mentioned, this could be as long as 6 months, right? So that is too long, as you correctly said, Kemal. Clearly, it is very important that we take time to educate, evaluate our patients appropriately so that they are really well prepared to have safe bariatric surgery, and they are well empowered also to have all the tools for success after bariatric surgery. That takes time, but it shouldn't be 6 months, right? It shouldn't be in a way where the patient is almost has to earn the right to have bariatric surgery by being punctually present at all those nutrition classes once a month, so that if they miss one, then they have to restart everything. That is almost like putting a hurdle in the process, right? We don't have hurdles like that with other forms of treatment, whether we are treating somebody for an illness like cancer or other medical conditions. We do the appropriate preparation and we do the surgery. So there shouldn't be this type of onerous requirement for bariatric surgery, which very often discourages the patients, right? We've made a lot of progress in that sense because of the work like that you do, for instance, with writing articles and advocating for patients. Now many insurance companies are actually dropping those requirements, understanding that this creates more obstacles than benefits to the patients. But also we have ways to go. One of the important things that we really struggle with, for instance, Kemal, is, as you correctly said, there are some insurances that don't cover bariatric surgery as a benefit. In fact, there are some plans that exclude bariatric surgery as a benefit, which makes absolutely no sense. Because for morbidly obese patients, obesity is the central health problem they have. And to tell them, yes, we will take care of everything else, but this main problem that you have makes no sense at all. And our endeavors to educate and to advocate for our patients must continue so that all insurance companies understand that bariatric surgery should be universally available for all patients who struggle with morbid obesity.
So again, Dr. Irgau, we kind of pick our battles to fight, right? So 6 consecutive months of telemedicine, nutrition is difficult, but right now we can do those on telemedicine. So I want our patients to focus on what's doable and what we can achieve rather than these impossible points. So we make these things available to them where now nutrition doesn't have to be an office visit. You can actually have that 1 hour initial one and then 30 minutes for the follow-ups on telemedicine. So you need to sign up for our IQ Health portal, and it makes it a lot easier. It's efficient. You need to still be in a private place where we can have the discussion with patients. But even for our follow-ups, I think we did increase the number of follow-ups we have with our patients, so they are more compliant with the program. We just need to take advantage of this crisis in a way that what good can come out of this. And one is, our patients don't have to leave their homes for many of these visits. Now, we also made these events available. So we try to make it topic specific. So that's not like, if you are like me and you don't want to watch like a 2-hour webinar, you can actually watch these shorter sessions and then maybe just pick up something from each. Now we do have weekly events on Wednesday, and then yesterday, for example, the 2nd and 4th Tuesdays of each month, we have webinars. So if you like the more structured, like the entire topic in one shot, you can watch the webinar. And our first Tuesday of the month, the bariatric support group. And then on Fridays, I have ACO, United Medical ACO, Friday at noon updates. That's also weekly. And our diabetes and nutritionist group, actually we have one event tonight. It's at 7 p.m. Amy will be there with us. So we are, now if you, Dr. if you look at this picture here, like the entire thing, there are like 5 different sessions just for patients.
Absolutely.
Now,
absolutely.
The good part of what we are maybe going through today is we were able to focus on the access for patients in different from different channels, so then they can actually, they don't have to be in the office to get everything and learn everything. Now, on our YouTube channels, we did make these, again, a lot more user-friendly. There are playlists for each of these, and you can find a lot of good information. Trust me, you don't have to watch Netflix. We have more entertaining stuff in these videos. And now, you know, there are ways to take this to a different level, and we have done it. Now, one good also news that I have, Dr. Irgau, our drop ratio is a lot lower than our hospital patients.
Yes.
So it's almost like 100% less, or like on the hospital side, it's 100% more. So just because this ownership of the care that we are providing from start to the end, that's really extremely important. And having the surgeons like yourself and our other surgeons, that makes it a lot more enjoyable for us. Now, anything you would like to add before we close?
So, Kemal, I mean, this is an extremely important topic. Essentially, what we are saying is that bariatric surgery preparation is necessary. It is very, very important for people to have a safe experience when they go through the surgery itself. And that safety is related to this preparation. But the preparation doesn't have to be difficult. It doesn't have to be complicated, right? If you come to a program like ours, where you have a bariatric coordinator that will guide you through the process, then it can be facilitated. And also, it increases the level of confidence and comfort of the patients also to know that this kind of support is present, Kemal. And it made a big difference. As you said, the dropout rate is a lot lower, the level of satisfaction of patients is way higher, and the surgeons are also very happy with the program because they see that their patients are going through the process smoothly, that all the necessary requirements are being met in a timely fashion when patients go through the process. Yeah, absolutely.
Absolutely. That's no, that's great, Dr. Well, I know you started in the office in Newcastle. You went down to Dover in Kent County, so you're back in Newcastle. Yeah. And I'm trying to get this in from your time, and I do appreciate for you being available and flexible. And we'll see you next week. And if our patients can actually subscribe for the channel so they can get the auto emails rather than us sending them emails, so that would make it a lot more efficient. Please subscribe to the channel, and we can make this even more efficient in the future.